So our next speaker is Lin Fang. Professor Lin Fang is currently an associate professor, holds the Factor-Inwentash chair in children's mental health, and is the director of the PhD program. Lin has over 10 years of clinical experience as a licensed clinical social worker in New York State. During the pandemic, Lin launched the Talk It Out Counseling Clinic that provides free short-term counseling services to lower income and Black communities in the Greater Toronto. Lin's program of research has focused on advancing the theoretical and empirical knowledge of positive child and youth development through etiology and intervention research, as well as community-based research and services. Recently, Professor Fang began to investigate the impact of anti-Asian racism in the East Asian youth and their families. She has published and presented widely in the area of adolescent substance use, information and communication technologies, and mental health and cross-cultural experiences amongst immigrant youth. Professor Fang, we would like to welcome you. And I would again like to turn it over. Actually, I think we're starting with Professor Fang sharing us a little bit about the clinic.
So thanks for everyone for giving me the opportunity to present to you Talk It Out Counseling Clinic. I think some of you have heard about it. Some of you, this is probably the first time. So in the presentation today, I will be starting to give an overview and as well as the updates where we have done so far with the Talk It Out Clinic. My colleagues from Jen and Finch Community Center will be here to share their experience working with Talk It Out. And lastly, we have a current MSW student who's doing a practicum with us. She's also going to share her experience. And at the end, we'll take some questions and answers and questions together. And I hope that I give you a good idea about what Talk It Out has been so far and how we're gonna move on in the near future. So Talk It Out Counseling Clinic, as Andrea mentioned, is something we launched this past year. The clinic's really, there's two things the clinic does. For one, we provide free counseling services to the communities in the GTA. Specifically, we focus on lower income communities as well as Black communities. As well, the second purpose and big purpose for Talk It Out is we are here to nurture and really try to help to nurture the social workforce development. The idea of Talk It Out really started during the pandemic. I think this question actually came to me before the presentation, saying, why do you want to do this? And this actually started out with, again, during the pandemic, March 2020. And I think everyone probably remember that's our first lockdown. We're basically told to stay home, don't go anywhere. Don't go anywhere. Agencies are locked down because we basically we all grapple with the new realities. I remember at that time I was home and talking to a friend of mine who was not a social worker. And I was like, what can social work do? What can we do? I feel so powerless. And this thing came up. This idea, then I was like, well, and then we talk about maybe I can do some surveys, maybe I can do some interviews with the community documenting the impact. And this friend of mine said, you know what, frankly, Lin, as a community resident, none of that actually matters to me. Since you're in a school of social work, can you guys actually do some social work? And I think that was the idea. I was like, maybe we should think about something different. And then that's also during the time in the faculty, we know that we know that there's a shortage of practicum placements. Again, there was people are shuffling with hours, shuffling between the hours. There's a lot of closure, just temporary closure of placements and whatnot. So there's an urgency also just for those practicum opportunities. So those two things sort of came together. So then I started thinking about, what if we offer what if we actually work with students and offer social work services to the community? And that's how it got started. The idea, luckily, we're fortunate to get the support from Alumni Association, from the Advancements Office, from the Dean's Office support, and we're able to then get some seed fundings and to start out the service. Over a year, almost close to a year of preparation, we're able to launch this past year in March 2021. Talk It Out offers brief counseling sessions online or over the phone and over a secure platform. The secure, when we say brief counseling sessions, that means short-term therapy sessions. So it's anywhere between 6 to 8 sessions, but we work with clients. If they need more sessions, we definitely have that flexibilities. Again, we target on lower income communities and Black communities in the GTA, and this is specifically after various consultations with our partners and with different stakeholders. And then we start to target on those two communities to begin with. The service are exclusively provided by our Master of Social Work students who are supervised by experienced social workers. The clinic is operating exclusively on this partnership model. We currently have 7 partners. Start with Taibu Community Health Center, Unison Health and Community Services Centers, part of Queen West Community Health Center, Jen and Finch Community Center, Black Creek Community Health Center, Christie Ossington Neighborhood Center, as well as North York Community House. With the last 2, Christie Ossington and North York are our 2 latest partners. And then when I talk about community partnership models, I should explain that the models specifically, all the referrals are coming from our partners. We talk it out, situate ourselves as one piece of solution of the care. So we just want to be part of solution, so it'll be part of the system of care. So all the referrals coming exclusively from partners. There is a warm handoff procedures built in place because as services are all mostly online over the phone, we know that it's very likely clients get a referral may not come. So we don't want to just be a drop-off site. We work with community partners exclusively and work on this together. So there's a warm handoff sessions virtually, usually using again a video therapy platform or a phone over the phone, so that community partners, the client, and also our social workers can all get together, just introduce the service. Then we get into counseling services for over, again, 6 to 8 sessions. And at the end, if there are needs that need to be met, community going to be addressed in the community, there will be a warm handover process. Throughout the process, there's ongoing communication with partners. So our clinic manager will maintain ongoing communication with the partners every 2 weeks. You will get an update from our community partners in terms of where the client is at. Are they still active? Are they not active? Are they about to be finished? If they're about to be finished with the services, what would that look like? So we actually work with the community partners very closely in that regards. In addition, there's various opportunities for students and partners to work together. We believe that we want to provide very valuable learning opportunities for students, and in this way, they really exposed to various community partners. So even though they are with Talk It Out, they get to know different community partners very closely. So we do that through arranging meet and greet sessions between community partners and students. Students also need to do community profiles. When they are assigned to with at least 2 or 3 agencies when they're doing their orientation. They had to interview the worker that they work closely. They actually had to do a lot of studies on their own, just knowing the neighborhoods where each of our partners serve in terms of the population they serve, the common issues we see, the services are out there, the gaps in services, and the strengths of the communities, and what kind of things can be addressed. And that will be part of their orientation weeks. As well, many of our partners also offering training opportunities to students. So I know Jen and Finch, for example, when they have something that's training that they are available, they are always extending that to our students that to go to their services. Some other opportunities that's from community partners, including agency meetings and things like that. And when our partners feel like this is a good thing for our students to be involved, they will actually send an invitation to us. As well, we also develop initiatives together on an ongoing basis. We're checking with our partners to see what can be done, what kind of things other than the sessions itself, is anything else that we can work together, which I should talk about that later today. Currently, again, we're mostly focusing on short-term therapy. The lens from our service is coming anti-oppressive practice and anti-Black racism. Also, it's trauma-informed and it's client-centered. The treatment approaches are most likely against those that that are geared to a more short-term focus. So you will see more CBT-based services, solution-focused therapy, or narrative-based therapy. But again, usually it's based on the client's needs, and then the students will work with their supervisors to figure out what may be most appropriate given the client's presentation issues of presentation. Here, just a list of, in terms of inclusion and exclusion criteria. So on the left-hand side are the kind of issues we typically receive. So for Talk It Out, because we only have, it's staffed by social work students, we don't have medical backup, we don't have psychiatrists. So we're very clear with our partners in terms of the clients, the type of clients we can take. If someone's having very urgent mental health issues, it's just, if there's if there's serious mental health concerns that requires medical care, or they actually have already, or they're coming for psychiatric, or if they are discharged by a psychiatric institute or psychiatric unit, then there's other places system that are available for them. So it won't be appropriate for us. But most other clients, so in other words, the clients we receive somewhere from probably mild to moderate mental health concerns, or just again need someone to talk to. Who do we have here then? Talk It Out was the seed funding we got. We were able to start off with actually a very thin structure. There's me as clinic director. I'm also a faculty member here at the faculty. We have one full-time clinic manager. We have several PhD students who are actually acting as supervisors, as well. We have work study students. So that's what we have so far, and we are hoping that gradually, with some more support, we'll be able to expand our structure so that we can extend ourselves further. A little bit about what this clinic is about. Putting a clinic together at U of T to me was like a startup company, because we have something similar here at the faculty, like Counselling, but that was for the students at the university, was not really providing service to the community. So to do this, to actually think about what this clinic will look like, and also because we are doing everything virtually, we want to have a place where students feel that they are supported and they actually are in an agency. So that's something we work very hard to do, to accomplish. So with their practicum times, Wednesday to Friday, there's daily check-ins and check-outs. So they set up that sort of virtual boundaries. There's check-ins and check-outs. It's like, as if you go to a working agency, there's a coffee. There's like, you'll go to cafeteria, just check in with your colleagues to see how their days are going. There are ongoing clinic meetings and case conferences. There's individual and group supervision that they happen by every other alternate weeks. There's also always an on-call supervisor. So when students is seeing a client, they are not going to be there alone. They know that they can reach out their supervisor by a chat messages or by a phone call. Supervisors always have meetings, so we do this in a team approach. So that's something. So every week, supervisors meet together to discuss intakes, to discuss student issues, as well as any training needs. And then lastly, every Friday, there's a Friday cafe. There's the drop-in sessions when students just want to drop in to talk to our manager about the issues and things. So there's drop-in sessions. They can be in touch with us. Over here, I want to talk about just a bit on student training. There's 3 components: orientations, supervisions, and in-service training. All the students who came to Talk It Out will go through at least 2 to 3 weeks of orientations. On the left-hand side, there's a list of topics here. And so we start from anti-racism practice and mental health, racial distress trauma. We have speakers talk about culturally responsive practice, cultural humility care, trauma-informed care, grief and bereavement, and practice elements from assessment, intervention to termination, telemental health essentials, which is very important as we're doing everything online. Our practice is the platform that we use here. So we have a lot of hands-on trainings on that, as well as in case there are emerging situations, crisis, now we talk about suicide assessment and crisis interventions. Supervisions, as I mentioned earlier, we have individual group supervisions that happen alternate weeks, Friday Cafe, as well as case conference that happens every week during our team meetings. Other than orientations and supervisions, the supervisor team actually work together just really based on things we noticed with the students' questions, the client, also issues that emerge from clients. We actually design then a range of in-service trainings. So that this typically happens during the group supervision time. So anywhere from writing good case notes, which we realize that's something very, very critical because now everyone knows how to do that. Linking theory and practice, assessment, working with clients in creating boundaries and intervention, the use of self, adverse childhood experiences, harm reductions, and the latest one, we actually also talked about single session services because we actually are in the process of offering single session service to one of our partnering agencies. So this is a partial list of the things that we do in the in-service training sessions. Now here then this component and this segment, I'd like to give you a little bit of updates of what we have done so far in terms of the clinic. Since March 2021, we actually have trained or are training a total of 17 students. 8 of them have completed and we have 9 that are ongoing. About 2/3 of them I identify as BIPOC students and over 1/3 identify as Black students. We have received total 90 referrals and 55 of them have completed services. At this point, the service is about 4.6 sessions. I had to say it's partially to do with one of our partner agencies that because they are actually serving, they're primarily homeless shelters. Ones who actually, and the shelter clients actually really have a different need, so they don't actually stay service as long as what we see with the referrals from our other partner agencies. And talk it out again, we offer free services, and the one thing we do is we really increase the access. People can access to us a pretty, not only it's free, but there's actually no wait list. That's something we stress on. So the first contact with client usually happens within a week after we receive the referral. Usually again, we receive the referral, we'll look at which student can take it, and then we'll discuss with students at team meeting and the contact will happen. So far, we have done over 360 sessions. And so far, we do not have any crisis incidents at this point. And in terms of the clients we have, you see a range. The clients have to be 16 years or older. We have a sort of widespread. We have clients young as 16. We also have clients as old as over 60 years. So the average age at this point is 38, about 38 years old, with about 2/3 of clients are female and 1/3 are male. Here are just the racial, the racial background of our clients. About 44% identify as Black, 11% Asian, Latinos 10%. We have also 18% identify as white, and 2% clients identify as Indigenous, and 4% identify as mixed race. And based on the referrals we have, here is a list of the concerns that came with the referrals. So anxiety being the most, anxiety and stress are the top, family issues, depression, trauma, relationship challenges, grief and loss, low self-esteem, mental health issues, issues with study, loneliness, isolations, COVID-19, and identities and whatnot. So here you can see the range of issues that we deal with. Now, the last component I would like to talk about is just then what we are going to do next. There are a few things. At student and training site, where we are hoping that we can have more meaningful integrations with faculty curriculum and faculty engagement. We actually previously, Alan Katz, who is a faculty here, has been actually supervised our students. So we're looking into then but supervision actually does take a lot of time. I think many of you are supervised and knows how much time it takes. So we try to look into ways to re-engage faculty members, anywhere from doing workshops or doing, attending case conference, giving student feedback, or actually supervise students and whatnot. So those are the things we are hoping to do. In terms of service and operations, I think one thing, again, because we work with our partners very closely and we hear their feedback, we are actually starting single session model now with Christie Ossington Neighborhood Center, because we realize that people in homeless shelters, and that's where Christie Ossington might primarily serve, people from people who are living in shelters they're just very different from our other clients who have a roof over their top. So we're thinking about how to do this right, because it's harder for them to come up here Wednesday afternoon at 3 o'clock and do this. They are transient. So in our discussion with our partners, we are now thinking about, let's do some single session model. Let's just do drop-in and see if they will come. So we actually have been working on that since late last year, and we just actually started doing that this past week. We are also thinking about doing psychoeducation groups with or mental wellness promotion with our other partners. I think Jen and Finch. This was North York Community Health has talked about. We have clients who obviously have mental health needs, but they will not come to individual sessions. We need to find some other ways to do. So the group sessions and group ideas in a non-threatening way to just really inviting clients to just talk about well-beings and well-being and health, and something that we've been thinking about. And so that's something we're planning the next. We're also thinking about potentially working with our partners on site. So actually before Omicron, we're actually thinking the possibility where some of our students may actually go to our partners agency, just stay there for a day and see clients. So that's something we've been thinking about, but obviously with Omicron, we're not sure when that can happen. But again, that's the direction we're thinking. As well, we have also been thinking about increasing focus to senior populations, as well as people experience chronic physical health and mental health concerns. And that came up specifically with some donors who are interested in providing this front. So we're thinking about ways we can integrate that in the service we do. And one last thing I want to say, in under service operations, we have learned a great deal in this first year because Talk It Out operates in the university. We work with student practicum. There's the academic flow we are working with. So currently we have 9 students, but in the summer we don't have that many students. So we had to manage the referrals. So we had to manage the caseload and also just managing partner expectations. This is something we learned a great deal this past year, and then we continue to strengthen that. So it's meaningful learning opportunity for students, but also I want to make sure that clients are really getting the service they need. And the last piece is research evaluation. The first year we have enough resources to get the clinic up and running to see clients, and we are very happy about. But we need to also spend some effort, and we need to spend quite an effort to really looking into research evaluation, basic quality assurance for any agencies, as well as understanding the experience from our clients, our students, as well as our community partners. So that's something that we are hoping to do in this upcoming year. This is my last slide here. I just want to thank you for your support and generosities. Many of you actually in today's call, I talked to Andrea a lot, and at the beginning when I was talking, was just thinking about maybe the possibility of this clinic, and I remember Andrea say, I'm going to ask you hard questions. I'm going to be very frank. So I always remember those conversations. There's Judy for your support, and yeah, there's so many people, so I probably cannot name all of you, but just again, I want to thank you support, and particularly Alumni Association has also made donations to the clinic, so I want to thank you for that. Now, I guess I will stop my presentation here. Right. I would like now just to turn the microphone, if I have a real one, I'll turn the microphone to my colleagues at Jen and Finch Community Center, Vhil, Basma, and Kimbra. Vhil is the manager of community well-being, and Basma and Kimbra are the community well-being workers. So Vhil, please go ahead. We cannot hear you, Vhil.
And oh,
it's good now. It's good now.
Oh, it's good now. Okay. Hi again. Sorry. I just wanted to say good evening to everyone, and thank you, Lynn, for having us here, and thank you for the Alumni Association for having us here, and also for funding the Talk It Out Clinic. It's been really a game changer in the field that we're in, especially during COVID times. So before I start, please allow me to share my screen really quickly. There we go. I just want to make sure that everybody is able to see the slides.
Yes.
Yes, perfect. Thank you. So my name is Vhil, and I'm the manager of community well-being at the Jane and Finch Community and Family Center. And tonight I am with two wonderful colleagues, Kimbra and Basma, who are both well-being workers at the center. And this evening, it is a pleasure to share our experiences with the brilliant and ever reliable Talk It Out Clinic and the team, and also Lin. So to begin, I'd like to share a little bit about the center. So the Jane and Finch Center is a multi-service, community-based organization with a strong focus on poverty reduction through resident engagement, capacity building, and anti-oppression. And as an agency, we offer a diverse list of programs, including, our very own community well-being program. We have family services, we have youth and settlement services, community development, and other community resources. And although our services may extend wide across the northwest quadrant of Toronto, we primarily serve residents of Humber River, Black Creek. Majority of the population are Black and racialized or are newcomers to Canada. And to add to that, as a result of a long history of racism, of systemic discrimination, and of significant austerity measures from decades ago and up until now, this neighborhood is also largely characterized by poor social conditions like, high rates of poverty and others listed on the screen right now. And as we know from our knowledge of the social determinants of health, these realities experienced by the community in turn put the community at a very high risk for negative mental health outcomes. And in addition to that, reports also indicate a significant unavailability of mental health services within Jane and Finch, which then leads to a lack of access to them, and which in turn further exacerbates mental health outcomes. And in 2020, as we know, COVID-19, this pandemic made mental health worse for residents of Jane and Finch. Not only did people experience lengthened time in isolation or loss of income, loss of jobs and other conditions, wait lists for the very few mental health services also grew significantly longer. So really, Talk It Out, the Talk It Out's decision to offer their services to residents of Jane and Finch by working with Jane and Finch Center filled in so many gaps within the community and provided a much needed response to the issue, especially during this time of the pandemic. And the strong partnership that we have with Talk It Out reinforced current programs that we have right now and created a much needed orchestra of services that are holistic in nature, services that consider both the social and clinical aspects of mental health. And the clinic's engagement made counseling much more accessible to our residents for many reasons, but I'll list a few, and I'm sure that my colleagues will mention a few of them later on. But first, it's because the services are free, which is a big sigh of relief for many of our residents who are living from paycheck to paycheck, which is much more pronounced during this pandemic. Second, because it was immediate, right? Unlike many services where clients would normally wait months to a year or maybe even longer at this point, at which point, it may already be too late for them to access services. And lastly, because it was open to a wide range of individuals across the lifespan, which means that our clients who have aged out of youth mental health programs now have access to supports that they can rely on. And really, Talk It Out Clinic has been so reliable and has addressed so many different barriers that, has been mentioned earlier, and Lin has alluded to earlier, and which in turn made significant and lasting impacts on the lives of the clients that we see at Jane and Finch and the residents that we have at Jane and Finch. So for the next several minutes, I'd like to invite both Kimbra and Basma to talk a little bit more into detail about our experiences and realities with Talk It Out Clinic. Kimbra?
Thank you, Vhil. So ultimately, our partnership with the Talk It Out and has been dependent really on on the effectiveness of delivering services to the community. So for starters, the warm handover approach has been fundamental in the success of the service. So within this process, our clients are introduced to the Talk It Out therapist through a conference call which includes our community well-being worker. So through this call, the community well-being worker will introduce the client to the student therapist. This approach has really allowed for clients to feel safe and feel supported in their transitioning into counseling service. So it also ensures that the therapist and the client are successfully connected. And it really lays out the foundations for trust to be built. Secondly, the collaborative relationship between the Talk It Out team and the community well-being workers has also really contributed to the success of the service. So the opportunity for collaboration between the therapist and the community well-being worker has ensured that barriers in accessing mental wellness are being addressed. So an example of this would be a client may have issues surrounding settlement, and the issue has taken a toll on their overall mental health. So when these issues are being addressed during the counseling session, the therapist, with the consent of the client, of course, would refer back to the community well-being worker to help in connecting the client to the appropriate settlement services. So this process is what ensures that the clients are provided with more of a holistic approach to mental health support. So it's been like really a kind of collaborative relationship that we've had so far. It's also important to note that the Talk It Out team have worked tirelessly in ensuring that the referrals, initial contact, and the intake sessions are also completed in a timely manner, which I think is really important for our clients and a really critical component in building trust with our clients. Thirdly, the quality of service, whereby the Talk It Out utilizes a more of a client and community-centered approach in providing service, is incredibly important. So this approach ensures that our clients' desires, goals, and experiences are valued and centered in their healing journey. This approach also centers social justice and anti-oppressive framework that combats and balances out the traditional power dynamics between service providers and community. But also, it's really important to note that the Talk It Out team is made up of student therapists from diverse backgrounds, which allows for the community to see people of color reflected in the support that they receive. So this builds more stronger bonds and reinforces the importance of seeing service providers who are actually from the same communities. And lastly, the model of collaboration between community and educational institutions is innovative in nature, and it can be a blueprint for other institutions to follow suit. So it also allows for resource-privileged institutions to redistribute resources to marginalized communities. For communities such as ours, who are consistently experiencing barriers in accessing mental health, I think that the service was very much needed. And it really has been a beneficial also to the community and the center as a whole. And I will pass it on to Bas to speak a little bit more on the client's experiences.
Thank you, Kimbra. Good evening, everyone. So a bit about our clients' experiences. I specifically work with the youth, but we meet regularly and debrief. As mentioned by Vhil, the Talk It Out clinic joining us at the end of 2020 and beginning of 2021, there was definitely an increase in mental health needs, not only because of the pandemic, but also other underlying and intersecting barriers for community members. So it could not have come at a better time. There has been strong indicators of the impact of the clinic since then. Many clients have recommended the service to their peers, family members, as well as partners. Majority of our referrals do come from word of mouth, which has shown that these clients are not only benefiting from the service, but are excited and able to share with those around them. In addition, majority of our referrals from youth have been for the Talk It Out clinic, specifically seeking help with their mental health as well as counseling needs. Clients also have been eager to return to the Talk It Out clinic after being discharged, or once we follow up with them within our 6-month follow-up program, they have wanted to inquire if they can continue the service, which has again reinforced the impact of the clinic on these individuals' lives. The Talk It Out clinic has taken a strong client-centered approach, which has been very much reinforced through the feedback we've gotten through our clients. So there's a high centered quality care, as well as the trauma-informed background that these therapists have taken on, as well as understanding the specific needs of the community, has really shown in the feedback we've gotten from our clients. For example, as Kimbra mentioned, the client's intersecting needs and not afraid to collaborate with us to best support the client. So we've been able to connect with these therapists prior to our warm handoff process and really understand what those needs are, understand what each individual client's barriers are, and connecting with them to best suit them. So I'll get to the next slide. So lastly, we've gotten a couple of testimonials that we wanted to share, specifically this one. So this one is of a client of Kimbra's. So Kimbra works with our adult population, and this client was referred to Talk It Out after losing their mom and was experiencing depression and anxiety. The Talk It Out service really supported him in working on his grief and exploring his emotions. So as you can see, the client, I'll read the quote, "The service navigation service was able to connect me to Talk It Out Clinic. The Talk It Out counseling service was awesome. It helped me work around the emotions. I was able to work on my goals and action plan. I feel confident to work towards my own personal healing." So this is one of the many feedbacks that we get from many of our clients. I can personally say that anytime we have an evaluation or debrief with our clients or check-in, Talk It Out is not the first thing that they mention. It is one of the top positive feedbacks that we get. So to be able to continue to work with this partnership has been amazing. So I will go to our next slide, please. So I bring you to my last slide, which is why why Talk It Out is so important in our current and future clients' lives. So as mentioned by my colleagues, it has been proven by multiple factors, such as addressing the barriers in our community, as well as the testimonials that I've shared, and also the rich relationships that they've built with us in how they approach their interpersonal as well as client-centered approaches. It's also been able to show that there is an exciting new cohort of therapists that have been well-rounded and formed around the community needs. This understanding of what trauma-informed care looks like, as well as understanding the unique needs of different communities, has been really impactful. It's also been able to promote what our goal is of community well-being within the Jane and Finch community. As Vhil mentioned, accessibility to services has been probably one of the greatest things, especially with timing. So the short wait time, the affordability, as well as the diverse representation of therapists has created more representation and has been a huge selling point for the Talk It Out clinic that many clients have raved about, and quite frankly have been really excited and almost shocked to say, so it's free. I don't have to wait. Is often remarks I get, and I'm beyond elated to tell them, yeah, it is free, and this is a service that we can provide for you and within weeks, not months or years. So that has always been something that I'm very grateful for. Lastly, there's still a lot of work that needs to be done, and we hope to continue to do this with the Talk It Out Clinic. So as we know, working with clients and communities who have experienced trauma in their lives, particularly around systems who face multiple intersecting barriers and needs, the stigma around mental health access, we still have a lot of work in building trust in relationships and promoting mental health knowledge and awareness. It will take time to build these relationships in our community. As social workers, we know that taking away a service like the one that is operating so successfully for a year will cause more harm than good. So as we know that short-term services do more harm than good most often. So we would encourage and hope that we can continue to build this relationship with the Talk It Out Clinic, and most importantly, that they continue to build a relationship within the community itself. And lastly, I would like to thank the Talk It Out Clinic, as well as the University of Toronto on behalf of Jane and Finch Community Center, and the clients you have greatly impacted for the partnership with the Talk It Out Clinic. And we are excited to continue to build a strong partnership in the future, hopefully. Thank you so much for your time.
Thank you so much, Basma, Vhil, and Kimbra. And I can't even say how much I appreciate you. Like, you even put slides together. Thank you for even coming to, not just to share this experiences. I promise I did not pay them. It's a mutual partnership. Thank you for all the kind words. I know we are coming to the end, but I know one of our students is here, so I want to give her some. I'm hoping that she can also share, have time to share some of her experience with Talk It Out. Claudia, are you here?
I am.
All right. You can take it away from here, Claudia.
Sure. Good evening, everyone. And thank you for the invitation. I appreciate it. Just hearing some of the feedback is really awesome. Like, Lynn shares this information with us all the time, but to actually hear it from the partners feels really good. I'm in my second year. So my name is Claudia Appiateng. I go to the University of Toronto, of course. And I've been part of the Talk It Out Clinic, I want to say, since May of last year. And it's been a great experience so far. I am someone who is moved deeply when we do have services, mental health services that are available for our more vulnerable populations. I'm someone who grew up in the Rexdale community. I was always in Jane and Finch. So for me, it's really personal, and to be able to connect and provide support to others that look like me, that sound like me, has always been something that has been top of mind for me. I'm in the mental health stream for this exact reason, because I realize that there is a huge gap in being able to provide mental health services for those who are in need of it. And a lot of clients that I've been able to communicate with thus far, are really grateful for just having the space to speak freely about their emotions, about their challenges, about some of their traumas, and being very open and forthcoming with that, because we look and we sound like them. And that's what's most important for me. That's what's most important for them. Kimbra, it's very nice to see your face. I have heard your voice in all of the referrals, but now I see your face. I've got a couple of your clients, and one of them in particular, I was able to build a really strong connection with, just because we understand each other. She doesn't have to say much, and I get where she's coming from, and there's that relatability there that I think is so important to the therapeutic alliance. So just being able to provide this service in the populations and in the communities that just don't have the accessibility to it has been great so far. So I'm learning a lot. Every day is a learning experience, and just the support of the Talk It Out Clinic. They make it easy. They make it easy for me to be me, and that's something that I always express, because in a lot of these spaces, I've been silenced. So just being given an opportunity to speak and share kind of what my experiences are as it relates to some of the clients that we're working with is of utmost importance to me. So I appreciate the experience. Thank you so much for inviting me, Lynn. Thank you for having me on the team. And I look forward to continuing to be part of this opportunity. So thanks, everyone.
Thank you. My goodness. This has been Professor Fang, Vhil, Kimbra, Basma, Claudia. I think you pretty much covered all aspects of such an amazing clinic. And I just want to say thank you so much for coming here, sharing and talking to us about the clinic. You have to come back again, because I'm sure there's lots of questions that we'd like to ask. I'm curious about funding, future funding, expansion of more partners. And I too, I grew up in the Jane and Finch area, so I'm so glad to see this program just impacting on such a beautiful community. And so we hope that you'll come back again soon.
Okay, you were expressing such a heartfelt gratitude. Oh my. And we all join you with great thank yous and great gratitude for hearing about this program that we know has been incubating. And so we're very happy with the successes that was shared. We're very happy to hear that everyone seems to be so happy. The outcome is so significant. The outcome, it's such a blessing to have it. Thank you.